What's hiding underneath things can be scary. Underwater, under your bed, especially what's under your carpet. Except when you get new carpet from Carpet One Floor and Home. After tearing up your old carpet, they'll vacuum and apply Health Annex antimicrobial to your subfloor, disinfecting and killing mold, mildew, and any remaining general awfulness. Carpet One Floor and Home goes the extra mile to protect you, your family, and your home. Carpet One Floor and Home in Columbia, making your home beautiful, guaranteed.
Good morning. Welcome to Radio Friends. This is Tuesday, August the 4th, and Valorie Livingston is with us from the Boys and Girls Club. Always a pleasure to have you here, Valorie.
Thank you.
But actually, she came in today and she said, things just get harder every day for Boys and Girls Club. With this coronavirus pandemic that's gripping the country, you had a big blow, right?
Yes. Yeah, so in the nonprofit world, fundraising drives everything that we can and cannot do. And so this week we lost a $400,000 grant, some state funding. So for the nonprofit sector, when you lose funding, you have to begin making cuts.
So you lost $400,000? That was for a year,
yes,
right?
Yes.
So what happens?
So we're going to have to really be mindful of how many staff, we can afford to have on payroll and how that
and you're not
ultimately
paying that
drives.
staff very much either.
Right. It's hard. Yeah, not in the nonprofit world.
Right. You're not paying that staff very much. And that's what's sad about the whole situation is.
Yes.
They're doing a very important job. They're not making a lot of money, but some of them are going to have to be let
kids.
Go. Yeah.
Yeah. And that means we serve less kids. And how do we get back to normalcy, and how do we the kids need us more now than ever. And unfortunately, in the nonprofit world, the dollars drive what we can and can't do. So that means we're ultimately not going to be able to serve as many kids and be able to support these families that need us more now than ever.
Right. So how many kids have you served and taken care of?
So this summer we have 70 kids
70.
Attending our summer camp program, but normally we would have 250. In our after-school program, which would start next year, and we're working very closely with the school district on expectations for safety, we would normally have 350 kids, and we'll be lucky if we can serve 50% of those kids.
Is that with that $400,000 cut?
No, that was before. So
that was before.
Yeah.
So now it means that you're going to be able to help even less
kids. And we're so worried about the academic learning loss that they are suffering from getting out of school early and how they're going to start the next school year. And some of them are doing virtual learning. They're staying at home, and food insecurities for families that we've been serving meals. We have served over 45,000 meals since March to make sure kids don't go hungry.
Right.
And all of that takes time and effort and funding. And so, mental health of children and the well-being of their families are so stressed right now because of COVID. So there's just so many needs out there for kids. But, it's going to take the community rallying together, and probably now more than ever, the old saying, it takes a village to raise a child,
right,
is probably more true now than ever. That
go back to the number of meals that you've been providing for kids.
Yes.
You said how much?
45,000 meals.
45,000 meals that you have provided. Now, will that also have to be cut because? Yes. So what's going to happen to these kids?
Yeah, I mean, I think it's going to take the community really rallying together to help everyone through this coronavirus and getting back to normalcy. We're talking a year or two down the road, possibly, before we see what normal was before COVID hit. Mm-hmm. And what can we do in the meantime? I think that the nonprofit world now needs more support than ever to be able to partner with the school district and with the families to provide support. We also have been delivering program activity kits to kids now because they've been at home.
What are program activity kits?
So simple program resources that we probably had growing up that these kids probably don't have at home, like hula hoops, jump ropes, sidewalk chalk, bubbles, balls, things that they can have healthy, engaged activities with because they've been home for 5 months with nothing to do. And So we're being very strategic. We're trying to support the whole family and the child and all of their needs, from positive, activities, and keeping them engaged, delivering books to them to encourage them to read and keep up with their academic efforts, to just having something to do to play outside, because they can't go to the pool, they can't go anywhere. So literally they're just outside with nothing to do for the entire summer. And so that's a lot of need.
What do you see once we get into the school year?
We're working closely with the school district. We're working closely with the bus transportation on what everybody can and cannot do. How do you social distance this many kids? Face
How
masks.
do you social distance?
Face masks. We required our kids to start wearing face masks at the Boys and Girls Club, and that's been really hard on kids to keep their mask on and to not lose it.
So how do you explain to a youngster that they have to keep that mask on if they don't want to get sick,
right,
or if they don't want to make somebody else sick?
And they're very scared. They don't understand. And they can't see your face, so they can't see us smiling. We can't hug them like we would normally. I mean, that's socialization, right? So when you can't do all that stuff with kids, it has some very long-term mental health consequences, because they're scared and they don't understand what's happening. And that's going to have some very long-term mental health concerns for society.
Now, do you have direct contact with the kids, working with them?
Yes.
What do you say to somebody who comes to you and says, Miss Valorie, I'm afraid. I don't know. I don't understand any of this. Why do I have to put this thing on my face?
Right. And it's hard because they run to you because they want to hug, and you have to stop them. And really, we're just trying to get down on their level and talk their language.
And that's got to be hard if a kid runs to you to get hugged, and you say, I can't hug you.
You have to stop. Yeah,
I can't hug you.
Have to, we've been getting on their level and trying to explain that there's just some germs in the air right now, and we don't want you to get sick, and we love you so much that we're going to keep you safe, but we can't hug right now. So let's come up with another way that we can share together and be happy. And you just have to figure out, what does that mean to that child? And sometimes it's just sitting down and coloring with them, or just reading a book with them and spending some time with them. But when they can't see your face and they can't touch you, that has a lot of mental health consequences for those kids, because it's hard.
Yes, it is. And I had not thought of it in those terms. If people listening, watching, if they want to help out to the Boys and Girls Club, what's the best thing to do?
Yes. Well, obviously we need financial support.
Okay.
We need to do some fundraising to raise dollars to keep our staff and be able to serve as many kids as we can.
So you can go to www.bgc-columbia.org.
Yes.
That's
every dollar counts.
What's that?
Every dollar counts.
All right. So go to that website, and you can make a secure donation on the website.
Yes.
If you want.
Yes.
All right. Valorie, thank you so much for coming by. Please come back again. Keep us posted on how things are going, and we wish you the best. If there's something you'd like to hear or see, drop me an email, pepperp@missouri.edu.